As knee surgeons, we think of the knee as three separate compartments. There's the inside or medial compartment, the outside or lateral compartment, and then the patellofemoral compartment, which is the kneecap. And a partial knee replacement may be indicated if the arthritis is isolated just to one part of the joint, and that typically is the medial compartment. Partial knee replacement is recommended if the arthritis is isolated to only one compartment of the knee. The advantages of a partial knee replacement are that it is a smaller surgery than a total knee replacement, so the recovery tends to be faster and easier. And then long term, since you're only replacing a portion of the knee, it tends to feel more like a normal knee. So especially for patients that are more active, it tends to feel more like a normal knee. Partial knee replacement is performed by entering the knee joint on the inside part of the knee, removing the arthritis from the ends of the bone on each side, and replacing that with metal, and then putting a piece of plastic in between. And you can see, looking at this model, it's only the inside part of the joint that's replaced, where we leave the outside part intact. Partial knee replacement patients always go home the same day after the surgery, and it tends to be an easier, quicker recovery than a total knee replacement. The recovery from partial knee replacement is similar to a total knee replacement, but much faster, meaning we allow patients to put weight on it right away. They do physical therapy, but for less time than a total knee replacement, and so they tend to be more recovered by 6 weeks, and long term, they should be able to get back to all the activities that they enjoy doing.